Okay. All right, Jessica. Welcome, everyone. My name is Kristen Mostowski. I'm the Director of Marketing and Public Relations for Community Hospice, and we would like to welcome you to today's Community Connection seminar on tips to keeping our seniors independent and healthy, which is so very important. Jessica, oops, excuse me one second. I'm bringing up your bio here. I think I just closed it out. Here we go. Sorry about that. So Jessica, how do you pronounce your last name? Is it Ines?
For a lot of people, I just say Ines. It is Portuguese, so it's pronounced Ench, but Ines is fine.
All right, so Jessica Ines is what we'll go with. Jessica joined the Healthy Aging Association in March of 2017. She's earned her bachelor's degree in kinesiology with a concentration in health and wellness promotion from California State University, Stanislaus in 2016. Congratulations. In 2017, Jessica became a certified health education specialist. And as a fitness program coordinator, she assists the health and fitness programs manager with the design and or the implementation of the Young at Heart fitness program and the day-to-day operations of the Healthy Aging Association. Jessica became a certified Young at Heart instructor in August of 2016 and will become a certified Young at Heart master trainer in August of 2018, which passed, so you are a master at this point. She is certified as a matter of balance coach in January of 2018, and she became a certified master of the balance master trainer in May of 2018. She also facilitates fall prevention and health education topics in both group and individual settings for both the Healthy Aging Association and other organizations like ourselves. So we're really excited to have you join us today, and we're very grateful for you to take the time out of your busy day to help provide resources and education to our community members. And so with that, I would just like to, again, let everyone know that we are recording this. It will be available if you missed something or would like to go back or you'd like to share it with your friends and family on the Community Hospice YouTube channel. Go to YouTube, type in Community Hospice, and our channel will pop up and you will see this Community Connection seminar as well as all of our past there that are available for your viewing. If you have a question at any time, please go ahead and enter that into the chat box. I will be moderating that chat box and I'm happy to ask Jessica any questions that you may have. So Jessica, with that, again, thank you so much, and I will hand it over to you.
Thank you so much, Kristen. Just getting our PowerPoint. There we go. So thank you, Kristen, for having me here today. We're so excited that we can do a presentation to some extent, whether it be virtual or in person. So I'm glad to be here with you all today. As Kristen mentioned, I am here representing Healthy Aging Association. I do want to mention that a lot of these pictures, these wonderful pictures, were taken prior to COVID, prior to the pandemic, but we have continued to offer ways to keep older adults active and independent throughout this past year. So Healthy Aging Association is a 501c3 nonprofit organization, and our mission is to help older Americans live longer, healthier, more independent lives by promoting increased physical activity and sound health and nutrition practices. So I just want to take a moment to introduce myself and our staff quickly. So as Kristen mentioned, my name is Jessica Ines. I'm the fitness program coordinator for Healthy Aging Association. I also help to oversee the Senior Coalition of Stanislaus County. Healthy Aging Association helps to coordinate those meetings. Diana Olson, we are a small but mighty staff. So Diana Olson is our executive director here at Healthy Aging Association. We have our program manager, Samantha Borba. We also have Kylie White, who has done a couple of presentations here for Community Hospice. She is our program assistant, and she's also a health educator, along with Noelia Rodriguez is one of our health educators here at Healthy Aging Association. And our newest member, Geneva Evo, she is an outreach worker for Healthy Aging Association. All of our staff has received their bachelor's in kinesiology from California State University, Stanislaus. And for those of you that don't know, kinesiology is the study of movement. So we've all taken the time to really involve ourselves in the study of movement and how we can better help older adults live those independent, healthy lives. So a couple of our programs and services that I just want to mention briefly here, but I will go into a little bit more depth throughout the presentation. So some programs and services Healthy Aging Association offers is our Young at Heart Strength Training class, our Tai Chi for Arthritis and Fall Prevention. So those two classes were offered in person 2 to 3 times a week prior to COVID. Right now we are offering them via Zoom, but as Kristen mentioned, we hope to get back to in-person safely soon. But right now we are over Zoom. Our Young at Heart Steps program, our walking challenge. We also offer Leah's Pantry Food Smarts, which is online currently. It's a nutrition class. And we're also doing COVID-19 outreach. So that is something that is new to our programs and services, but we are excited to get reliable and up-to-date information out regarding COVID-19. And again, you can visit our website, which I have listed there, healthyagingassociation.org, for more information on any of these programs and services. But again, I will go into depth in just a minute. So today, as Krista mentioned, talking about tips for keeping seniors independent and healthy. A couple of things that we here at Healthy Aging Association felt helped to focus on independence and being healthy. So we're going to talk a little bit about staying active, eating nutritious food, and just overall wellness and how we can bring all these things together and feel good. So without further ado, staying active. So the CDC recommends that older adults get 150 minutes of exercise a week. And so in these recommendations from CDC, they also say at least 2 days a week of activities should involve strengthening muscles and trying to improve our balance by doing exercises such as standing on one foot and doing some stretching. So stretching and balance, adding those into our physical activity weekly. And so 150 minutes does sound like a lot of time for physical activity, but actually if we break it down, it's only about 30 minutes, 5 days a week. And this 30 minutes of exercise doesn't have to be done all at one time. If you're able to exercise for 30 minutes, that's great. For those of you that aren't able to exercise for consecutive 30 minutes, you can do 10 minutes in the morning and then 10 minutes midday, and then maybe 10 minutes in the evening. And that could be walking. Maybe you take a walk in the morning, you maybe walk after your lunch, and then maybe you walk in the evening time to equal your 30 minutes of exercise. And so just something to keep in mind as we are trying to be more physically active, physically fit in our day-to-day lives, just being a little bit more physically active, adding that walking or adding, sitting exercises to our daily routine. So a couple of benefits of exercise. So exercise can lower our risk of getting cancers and certain diseases, such as heart disease. It can also help us to prevent stroke. It can improve our quality of life and the way that we feel about life. It can also reduce anxiety that we may have, or different anxieties in our lives. Risk of depression. It can also reduce risk of dementia, including Alzheimer's disease. Benefits of exercise could also help improve our sleep. So our sleep quality could improve from exercising. Maintaining a healthy weight, improving bone health and physical function, just overall physical function, being able to do the things that we enjoy doing. Exercise can help us continue doing those. And exercise can also help lower the risk of falls and fall-related injuries. So those are just some great benefits of exercise for older adults. And there are many ways that we can be physically active. So a couple that we came up with. So some ways to stay active, stay moving, whether that be brisk walking, if you enjoy walking. Aerobics, maybe you like something a little more upbeat or higher intensity. You could try aerobics. Yard work and gardening, that's also a way to stay active, stay moving. Maybe riding a bike, doing yoga, working with resistance bands. Also, I want to mention here, not only resistance bands, but maybe you use light weights for exercise, dancing, Tai Chi, and right now is a great time for swimming. It has been quite warm, so swimming is a great way to stay active. And also it is recommended for older adults to include stretching and balance activities as part of our weekly physical activity to keep us being able to do those things, do all of these exercise routines, but also just being able to live our lives comfortably. So some tips for starting an exercise program, whether you don't exercise at all, or you haven't exercised in a long time, or you are looking to get into an exercise program. Some tips for starting an exercise program. We do recommend that you check with your healthcare provider prior to starting any new exercise program. Just making sure that you're ready for exercise, or if they have any concerns that you should take into consideration. A great thing to talk with your healthcare provider. Finding a class that you enjoy and brings you happiness. So maybe it's not a class, maybe it's just walking, or maybe it's doing some activities around the home. We encourage you to do something physically active that you enjoy. We're more likely to keep doing it if we enjoy it. Setting realistic goals and expectations for ourselves. So we don't go out hoping to walk a marathon or run a marathon tomorrow, working up to that goal, if that is your goal. Whatever your goal may be, working up and building that strength, building that flexibility to be able to overcome those goals. Starting with a friend, a neighbor, or a family member, maybe it's more encouraging and maybe you can keep each other accountable if you start with a friend or maybe a family member. Ease into exercise. When joining an exercise class, try and do maybe half of the class or half of the repetitions. So we do encourage this, whether you're starting a new class or maybe joining a new program, doing maybe half of the class just so you can kind of get the feel for the exercise program and the exercises and build up that strength and that endurance to be able to do the whole class. We encourage our participants when they start a new class, we don't want them feeling sore and we don't want them coming the next day and not feeling well. So we do encourage them to do half of the class just so that they can see what the class is about and work at their own abilities. So trying to be as active as possible whenever we can. So a couple of examples of this for anybody and older adults. Parking as far away from the entrance as you can. Maybe that's at the grocery store, maybe that's at the bank. So you can get in those extra steps before you enter the building. Moving during commercials. So whether you're seated or you're standing, maybe you march a little bit during commercials, maybe you move your wrists, or maybe you move your ankles during commercials, and starting or ending your day with a walk, just to be as active as we can. So strength training, for those of you that don't know, strength training has many benefits. So regular strength training can improve and prevent muscle loss. Strength training can also improve balance, strength, and coordination. And then strength training also decreases your risk of falling. And it can also help us maintain our independence. So being able to exercise helps us to do the things that we enjoy. So our Young at Heart strength training classes, this is a practice-tested intervention. And our strength training classes, the equipment that we use in these classes is a rubber resistance tubing with soft grip handles. And we have 4 levels of resistance. And those soft grip handles are for those that have extreme arthritis in their hands. So the soft grip handles are really nice, especially for those with arthritis. These classes, as I mentioned, each class is an hour long and they meet 2 to 3 times a week. And these classes work on strength, balance, and flexibility to reduce the risk of falling and maintain that independence. And due to COVID, as I mentioned prior, these classes have been transitioned to be online via Zoom. We do hope to get back in person, so that bottom picture there is one of our in-person classes prior to COVID. And then the top picture there is one of our wonderful volunteers teaching the class via Zoom. So we have transitioned to Zoom. So if you do use the internet and you're familiar with Zoom, you can join our exercise classes, or you can give our office a call and join us in person when we get back to in-person classes. And then we also offer Tai Chi for arthritis and fall prevention. So Tai Chi for arthritis and fall prevention works to improve balance, confidence, and muscular strength. So Tai Chi is a slow moving martial art, and it definitely does take a lot of balance to be able to do the movements slowly and effectively. So this class does meet Tuesdays and Thursday mornings from 11 a.m. to noon on Zoom. So from the comfort of your own home, you get to be on Zoom and practice Tai Chi for arthritis and fall prevention. Prior to COVID, this class was in person as well, but right now we are on Zoom. So if this is something that you're interested in, again, these can be done seated or standing. So if you do have a hard time standing for an hour, you can do the movement seated, and you do still get great benefits to help your balance, your confidence, and your muscular strength. Our Young at Heart steps, so seniors tracking exercise in perfect strides. We host 2 12-week walking challenges, one in the spring and one in the fall. And registered walkers get to track their miles that they walk for 12 weeks. And then at the end of the 12 weeks, we get together and we have a brunch. The last couple of challenges, we did have to modify our brunch, and it was kind of a drive-through brunch. But it is great once we're able to be back in person to see everyone who was in the walking challenge, who also was walking and doing what they could to be active. We encouraged walkers to walk in the mall, to walk around their neighborhood, to join a neighbor or a friend and get in their steps each day. And so those walkers did receive emails to motivate them. We checked in with them every 4 weeks to see how they were doing and if they were meeting their goals. And then again, at the conclusion of the brunch, we had our sponsors there, and then we also invited all of our walkers so that we could celebrate and see how far that we all walked together. So if you are interested in walking, or if you are trying to get more steps in your day, the Young at Heart Steps program may be for you. And then along with being active, trying our best to be as active as we can, we want to make sure that we're eating nutritious food. So some benefits, especially for older adults, as we age, the benefits of nutritious food, it can lower our chances of getting cancer, keep our eyes and our heart healthy, keep our bones and our teeth strong. Eating nutritious food also helps to build up our immune system and keep it strong. Eating nutritious food also keeps our memory strong, and it can just help us to feel good overall. So some important foods to keep in mind as older adults, or if you're caring for older adults, or if you have an older adult family member. So varying our lean protein. So lean protein, that could be lean meats, seafood, eggs, or beans. Eating a variety of fruits and vegetables. So when we think of fruits and vegetables, thinking of that picture there on the screen, we want it to be colorful. We want it to be vibrant. So having the reds and the orange and the green and the purple in our diet, whether this be fresh fruits or vegetables, it could be frozen fruits or vegetables, or even canned fruits or vegetables. I do want to mention, if you do have canned vegetables, choosing the options with no salt or maybe low sodium, just so you don't have that extra salt added in there for the canned items. Trying to choose whole grains whenever possible. So there are many whole grain options. So whether that be whole grain pasta, whole grain bread, or brown rice, kind of keeping that variety in our diet. Low-fat dairy or fat-free dairy, and making sure that it's fortified with vitamin D, making sure that we have enough vitamin D in our diet. And then choosing foods that are high in fiber and low in sodium or salt, just to have that overall balanced diet. So our organization, Healthy Aging Association, has implemented since the pandemic, Leah's Pantry Food Smarts. And so these classes are offered via Zoom, and they are 5-week series classes. And from leading these classes, they have been a lot of fun. So we talk a little bit about different nutrition topics, and we get to talk with each other. So they're usually smaller groups here via Zoom. We get to talk and interact in different activities. We also have food demonstrations that we show. And then as a group, we get to talk a little bit about getting simple strategies to eat healthier. So if you're not a talker, these classes are still fun. You can interact as much as you want. So again, we do have some classes coming up in August if this is something that you're interested in, or maybe even learning some new recipes, or learning some strategies to choose healthier food options. Those are coming up in August via Zoom, and you can do it from the comfort of your own home. So that is one wonderful thing about Zoom, being able to do it from the comfort of your own home. And so along with being active, eating healthy, our overall health and wellness. So keeping the big picture in mind that all of these things play together and all of these things work together. So sleep is one of the things that we might not think about all of the time, but it does help with our overall health and wellness. So sleep, it is recommended for older adults to get 7 to 9 hours of sleep each night. And I know that might be a little difficult sometimes, but lack of sleep does lead to irritability, memory problems, depression, and it could lead to falls or accidents. So some recommendations in getting good sleep. So having that regular sleep pattern or that sleep schedule, trying to avoid napping in the afternoon time or evening, not watching television or being on devices that are in our face or in front of our eyes for too long before we go to sleep, having that comfortable sleep environment. So having that low lighting and that comfortable temperature. Exercising regularly. So as we mentioned, regular exercise does improve our sleep. Avoiding large meals close to bedtime, and then staying away from caffeine too late in the day. So our organization, Healthy Aging Association, does have Wellness Wednesdays once a month. And so these Wellness Wednesdays Zoom sessions, Dr. Bob McGrew does join us every other session. So if you are familiar with Dr. Bob McGrew, he does help us with our different fall prevention topics. And so we meet here on Zoom, we talk about fall prevention and our different topics. So we've talked about medication. Our next one, we're going to be talking about exercise, vision and hearing, home safety, and how these play into fall prevention and preventing falls in and around the home. So we have implemented these Zoom sessions to better educate people to prevent falls, especially during this time. So preventative care is also something that helps with our overall health and wellness. And I do want to mention that not only here are some suggestions for preventing COVID-19, but some overall illnesses that we may experience. So whether it is wearing a mask to cover our nose and mouth, avoiding close contact with others, and avoiding poorly ventilated spaces. We know that those are some things to prevent COVID-19, but also some overall hygiene. We want to make sure that we wash our hands with soap and water, and when soap and water is not available, using an alcohol-based sanitizer to keep our hands clean. Avoid touching our nose, our mouth, and our eyes with unclean hands. Not only could we spread COVID-19, but we could also spread other illnesses as well. Cleaning and disinfecting frequently touched surfaces daily, or if you know that somebody touches the doorknobs a lot, making sure that those are nice and disinfected. And if you haven't already, it is recommended to get a COVID-19 vaccine. So for our health, if you have been vaccinated, some new recommendations that are out by the CDC and also the state, being able to resume some of our activities without wearing a mask or staying 6 feet apart if you have had your vaccine. Still following guidance, whether that be in the workplace or local businesses, if they do ask for you to wear a mask or use sanitizer. If you are traveling, taking steps to protect yourself and others, whether that be wearing a mask or using sanitizer, just to keep yourself protected, but also others as well. Watching out for COVID-19 symptoms, whether that be yourself, a family member, a friend, but also other sicknesses and illnesses as well. Being aware of if somebody is not feeling well, maybe keeping your distance or maybe staying home if you yourself are not feeling well. And people who have a condition or are taking medications, they may have a weakened immune system. So we do recommend that you talk with your healthcare provider to discuss which activities you should involve yourself in and which ones you might want to be more cautious about. So this information was from the CDC. So I just do want to mention that. So if you did want to read up more, if you are fully vaccinated, you can see what you might want to take advantage of at this time. And if you're not yet vaccinated, we do encourage you that you can make an appointment on myturn.ca.gov or call that number there on the screen to make an appointment to get your vaccine. Also, the Stanislaus County does have clinics available that you can find a location near you to get a vaccine. And there are a handful of pharmacies in the area that are also offering the COVID-19 vaccines. CVS, Rite Aid, Walmart, Walgreens, Costco, and the great thing, you don't have to be a member to get it at Costco. And also Safeway does have the vaccine available. And I do want to mention Healthy Aging Association is working with senior housing at this time. It's very exciting. We're doing some outreach. So we're trying to reach older adults that may not have access to transportation, who may be homebound. So we are working with them to try our best to get them vaccinated for COVID-19. So some key facts about COVID-19 vaccines. They help protect you and others from getting the COVID-19 virus. So helping us to develop immunity to this virus. They are effective in keeping you from getting COVID-19. So these vaccines do not give you COVID-19. They are safe. So the US has various tests and safety systems that they do have to go through to meet standards. So this vaccine has met those standards and gone through those testing. And all of the COVID-19 vaccines are free. So the federal government does provide this vaccine free of charge, regardless of insurance or immigration status. And again, some of them may ask for your insurance, but you should not be billed for this vaccine. And then also, I just do want to mention it is really important to stay informed with reliable and up-to-date information. So we here at Healthy Aging Association, we put out a monthly newsletter, and we mail it via email or USPS snail mail. It is called Stay Informed While Staying Safe. And in that newsletter, we include information on not only COVID-19 and the vaccines, we also provide information on staying active, staying healthy, and also being, sorry, excuse me, and then also when things open back up and keeping our individuals and our older adults in our community informed. Also, the Stanislaus County website has some great information on the coronavirus and COVID-19 right here in our county. So sometimes there's just so much information. And so keeping it here in our county and knowing what we should do here. Center for Disease Control and Prevention, the CDC website, and also the California Department of Public Health, CDPH website has some great information as well. So just in summary of everything I've mentioned today, so 3 ways that we can stay independent and healthy. We can keep our bodies moving and our bodies active and strong. We can fuel our bodies with healthy food and just maintain overall health and wellness for our own well-being. If you are interested in any of our programs or services that I mentioned today, you can contact us by calling our office 209-525-4670, or you can shoot us an email, and I would love to help you get involved in our programs and services that we're offering. Sorry about that, Kristen. I went backwards. And again, thank you so much, Kristen, for having us here and telling you all about our programs and services and just ways that we can stay independent and healthy throughout our lives.
Jessica, what a wonderful presentation. Thank you so much. I know I learned a lot, and there are a couple, there is a comment here. It says, great presentation, Jessica. Can you sing it next time? And that came from Charles, the ombudsman. So,
thank you, Charles.
We appreciate your comments. I did include your phone number in the chat box as well. So if anyone would like to go ahead and write that down, it's 525-4670, and it's healthy.aging, correct? 2000. And what's the end of your URL? At
healthy.aging2000@gmail.com.
Perfect. healthy.aging2000@gmail.com. So that's a great email to also write down in case you want to know more about any of their resources. If you have any other questions or comments, we encourage you to enter them now into the chat box. We'll give you just a moment to do so. And then I'd also like to invite you to join us for our next presentation, which will be held on July the 28th. 12 o'clock, same time. You can use your same login information. That bit.ly code there is the same for all of our presentations. And that will be on July 28th, and it's on meditation and mindfulness tips, which is so important as a great way to take care of ourselves, right? And so Kieran Desi will be leading us in some common practices to help us and the importance of meditation and mindfulness. So please join us. I don't see any additional questions or comments at this time. So Jessica, again, thank you so much for joining us today and providing the great resources and all of your knowledge and enthusiasm. We really do appreciate you and everything that the Healthy Aging Association does for our community. So with that, we'll go ahead and end our presentation today. Again, it will be available on our YouTube channel, so please feel free to go visit the Community Hospice YouTube channel and share it with everybody that you know, as Jessica had some great resources. All right, guys, take care.
Thank you.